So it's about 5. I think we can start here. All right. So, all right. And hello, everybody. And welcome to the Lifestyle Medicine Interest Group Speaker Series. We're so excited today to introduce today's speaker, Dr. Reshma Shah. Just for a little introduction, Dr. Shah is a board-certified pediatrician with nearly 2 decades of experience caring for children and their families. She currently sees patients at the Santa Clara Valley Medical Center and is an affiliate clinical instructor at Stanford University School of Medicine. Additionally, she holds a master's in public health, is a member of the American Board of Pediatrics, fellow of the American Academy of Pediatrics, a member of the American College of Lifestyle Medicine, and has extensive training in plant-based health and nutrition. And she is the author of a wonderful book, Nourish, the definitive plant-based nutrition guide for families, which is an evidence-based practical resource that explores the many benefits of a plant-based diet and provides parents with the tools they need to feed their families for health and with joy. We are so happy to have her speak today. Thank you, Dr. Shah, for joining us.
Alex, thanks so much for inviting me. I was telling him just a few minutes ago that one of my most favorite things to do is to work with medical students and residents. So I'm excited to be spending some time with you this morning. And I'm just going to share my screen. Okay, so I'm going to be talking today about a plant-based approach to eating for health and beyond. And some of the topics are not necessarily directly related to diet and health outcomes, but as a pediatrician and really as a healthcare provider, I think it's really important for us to also be open to exploring the benefits of diet beyond our individual plates. So I'm going to touch on some of those aspects as well. So I have 2 main goals in our time together today. The first is I want to provide you with some foundational information as it relates to plant-based diets and really just be a launching point for further exploration. And the second is I want to be able to sort of inspire some individual reflection and change, because I think, as we'll see, diet and nutrition is a very personal topic. So I hope it's meaningful to you, both at a professional and an individual level. And this picture here is actually meant to remind me to share with you that many of the photographs that you're going to be seeing throughout this presentation were taken at, actually, Alex, the Palo Alto Avenue, the California Avenue Farmers Market in Palo Alto. And the reason that I do that is, first of all, because that market is just, it's one of the best reasons for living in California. So if you're ever in the area, I highly recommend you check it out. And also to remind us that at the end of the day, these conversations and the studies that I'm going to present to you, you want to be able to bring them back to the actual food that we're talking about. So it's a reminder that that's really what we're talking about. So I'm going to sort of address 3 main areas, and this can actually be sort of a guidepost in terms of whether you want to sort of veer off into more just Q&A or get through the topics. But I'm going to start off by, as I said, reviewing some of the broad benefits of plant-based diets. I'm going to address some common areas of concerns. I think that this is intentionally left brief because I imagine your questions will fill in the gaps of what I don't cover. And then I'm hoping to leave you with just a few practical tips and strategies to get you started and to help your conversations with your patients. So I think that nutrition is an incredibly personal topic. When you ask a patient, when you ask a family about what they eat and how they feed their families, you're basically asking for a window into their lives. And so I think it's only fair for me to share a little bit about my background when it comes to food. I work with the Stanford residents and students, specifically talking to them about plant-based nutrition. And I can't tell you the number of times our conversations veer off into what families' meals look like for them growing up and what they're hoping to accomplish in their homes today. So I'm Indian and I grew up in a vegetarian household. And so even though we didn't really call it at the time, I essentially grew up on a plant-based diet. We didn't call it that at the time. I won't tell you how many decades ago, but my mom really cooked with simple whole ingredients. We focused on family meals and that's sort of what I ate growing up. But I grew up in the United States and I was a typical American kid and I wanted to eat typical American food. So as I got older, a lot of these outside foods like hamburgers and hot dogs and all these things made an increasing appearance in my diet. And I'm really embarrassed to tell you that during my medical education and training, I made no connection between nutrition and food and the role that it played in our health. This was my nutrition medical education. It was complex biochemical pathways, which I don't remember, and how to feed preemies hyper-L. And the exciting thing for me, and I think one of the reasons that I enjoy talking to and working with the residents and students so much is because it's changing, because you guys are so interested in the role that nutrition plays in health, and you're interested in supporting your patients and families in understanding this connection as well. So the shift really happened for me at a personal level. So it's when I started having children of my own that I began to sort of become much more aware, because all of a sudden I was directly responsible for the growth and well-being of these two small children. And so I really started to pay more attention. I started to do more research and learn more. And this growing awareness followed me into my exam rooms with my patients. And the way that I spoke to families about food and nutrition dramatically changed. And I think it's really important, whether it's for your own personal nutrition or for the way that you speak to families, is to, focus on the journey. It's not about being perfect. Focus on simple whole foods, make stepwise progress, and really it's progress over perfection. And I can't emphasize that point enough. I think the first thing that we have to do when we talk about nutrition is to acknowledge that there is a lot of nutrition confusion, not only for our patients, but also for us as providers. 1 minute they're telling us that cholesterol is bad for us, and the next minute they're saying, don't worry, butter is back, it's totally fine. So when these kinds of headlines appear, it's no wonder why we're all so confused in terms of what diet is really best for health. So if there's so much confusion, how can we really talk to patients about dietary recommendations? And what I would argue is that there is actually overwhelming broad consensus. When you see a headline that seems contrary to what all the nutrition research suggests, just be skeptical. So when you look at the broad, overwhelming consensus from the leading dietetic, medical, public health, and research organizations, from the World Health Organization to the Academy of Nutrition and Dietetics, the American Academy of Pediatrics, the Harvard School of Public Health, there's actually quite a bit of broad consensus in terms of what constitutes a healthy diet. And there might be slight points of difference, but those are sort of on the fringe. And I think 80 to 90% of what these organizations are telling us is that we should be looking to minimize the consumption of certain foods that increase our risk of disease, such as saturated and trans fats, refined carbohydrates, cholesterol, and red and processed meats. And when it comes to the foods that we should really be looking to include more of in the diet, it's no surprise. It's vegetables, fruits, whole grains, beans, legumes, nuts, and seeds. So that's, really, if you want to know about plant-based diets, this is kind of it. So whether you're talking about keto or paleo, Mediterranean, vegetarian, vegan, all of these dietary approaches, today we're going to focus on sort of plant-based, and there's actually, surprisingly, quite a bit of overlap between all of these dietary approaches. So just for those of you who may be new to the term, I wanted to kind of define what we mean by a plant-based diet. So a plant-based diet is essentially a diet that aims to maximize the consumption of nutrient-dense plant foods while minimizing heavily processed foods and animal foods in the diet. So it's lots of, as I mentioned, vegetables, fruits, whole grains, lentils, beans, seeds, and nuts. And I also wanted to take a minute to clarify the distinction between plant-based or whole food plant-based and vegan. I think that whenever a label can be useful to you, you can fully embrace it. But if a label seems like it doesn't quite fit, don't worry too much about it. I think the reason that the term plant-based is a little bit more easy for people to sort of grasp is because it's a bit more inclusive. People feel like, I'm not a vegan, I would never call myself a vegan because it has a certain connotation. But when we talk about plant-based foods, I want to emphasize the foods at the bottom of this slide. So all the things that we talked about. The things on the top of this slide are all vegan foods, which means that they don't contain any animal products. But I think we would all agree that we wouldn't consider these to be health promoting foods. And so I myself don't have a problem calling myself someone who eats a vegan diet, someone who eats a plant-based diet. But again, don't let the terminology get in the way of sort of progress or your deeper understanding of nutrition. And again, progress, not perfection. I think that trying to focus most of your plate around those whole plant foods, and then every person is going to have their individual variability, whether they include some more processed foods or some animal foods in the diet. But what we're focusing on largely is what the majority of the diet consists of. And so there are three broad benefits to a plant-based diet. I'm going to share with you today that it's a healthy, sustainable, and humane way of eating and feeding our families. We're going to focus primarily on the health aspects. Is the volume? We have the gardeners are here, so there's like lawn noises. I hope it's not too disruptive. But today we're going to focus on mostly the health aspects, and then I'll touch on the other two issues briefly. So why focus on nutrition? Well, we know that nutrition is intimately connected to our health and our risk of developing several chronic diseases. It's estimated that nutrition is directly responsible for 80% of heart attacks, 90% of type 2 diabetes cases, 70% of colorectal cancer, and a variety of other conditions from stroke and osteoporosis, dementia, and so much more. When we look at answering this question of what diet is really best for health, we can learn a lot from the blue zones. And for those of you who may not know, the blue zones are these geographical pockets located throughout the world where they have the highest concentration of centenarians. So these are people that are living to age 100 and beyond. And researchers wanted to know, what is the secret sauce? Like, why are these communities enjoying such vibrant health? And they're located in Okinawa, Japan, in Icaria, Greece, Sardinia, Italy, the Nicoya Peninsula of Costa Rica, and right here in California in Loma Linda amongst the Seventh-day Adventists. And we're going to talk in more detail about the Seventh-day Adventists. But researchers wanted to know what these communities shared in terms of their health outcomes. And what they found was there was actually quite a bit of overlap. All of these communities tended to have a strong focus on family, low rates of smoking. They remained physically active throughout their years. They were engaged in their communities. And when it came to diet specifically, they all followed a plant-based or plant-centered diet. And all of these communities had legumes or beans as a staple in the diet. There have been several studies looking at the relationship between diet and mortality. The Adventist health population, they are a very interesting population to study. So this is a religious group, and part of their sort of religious beliefs and practices involve leading a very healthy lifestyle. So they have a lot of those characteristics in terms of a strong focus on community, remaining physically active, being engaged in their communities, not very low rates of drinking and smoking, but there is some variability in terms of the extent to which they follow a plant-based diet. There's a large percentage of this population that follow an entirely plant-based or vegan diet, but there are also people in this community that follow an omnivorous diet. So the reason they're interesting to study is if you keep a lot of those lifestyle factors sort of constant, what happens when you change the variability of diet? And in this really large prospective study following over 70,000 people, they found that a vegetarian or plant-based diet was associated with decreased overall mortality. There was another study that was published in the Journal of the American Medical Association back in 2016, in which researchers wanted to look at the link between animal protein intake and all-cause mortality. And what the researchers concluded was that high animal protein intake was positively associated with cardiovascular mortality, whereas high plant protein intake was inversely associated with all-cause and cardiovascular mortality, especially in individuals who had one lifestyle factor. And in fact, many of the leading causes of death in the United States are preventable and directly related to what we eat. The number one cause of death in the US is heart disease. 1 in every 4 Americans will die from heart disease in the United States. And cardiac stents and bypass procedures are life-saving in the acute situation, but they don't really get to the heart of the matter in terms of preventing heart disease from developing in the first place. It's estimated that 90% of the risk factors of heart disease are modifiable, which means that we have some say in our risk of developing heart disease. And so these factors include smoking, exercise, obesity, and of course, diet. There's been some research to show that even in people who have known heart disease, so these are people who have high blood pressure, who've had maybe a heart attack and had a stent placed, that they can reduce their risk of further heart disease by 78% simply by making aggressive diet and lifestyle changes. And again, there have been several large prospective studies that have shown the benefits of plant-based diets in terms of preventing heart disease from developing. And as a pediatrician, you might be thinking that heart disease, I mean, maybe this is one of the reasons I went into pediatrics. I didn't have to deal with heart disease and type 2 diabetes, but we know that heart disease, while it may manifest in our 5th, 6th, 7th decades of life, that it actually begins in pediatrics. There was a landmark paper published, you can tell from the font, it was published back in 1953 in the Journal of the American Medical Association, in which they wanted to examine these early risk factors in terms of heart disease. And what they did was they found, they looked at the coronary arteries of 300 soldiers that were killed in action. So these are healthy soldiers, presumably with no medical problems. The average age was just 22. And they found that 77% of these soldiers had evidence of coronary disease, ranging from fibrous thickening to complete occlusion of one or more of the branches. And so what this study really led researchers to look into was when do these vascular changes really begin? And autopsy studies in children have shown that atherosclerosis actually begins very early in life. You can see fatty streaks in the aorta of children as young as 3 years of age. By age 10, nearly all children have evidence of these fatty streaks. And by the time we're in our 20s, we're beginning to see these fatty streaks in our coronary. So heart disease is very much a pediatric health issue, and true primary prevention actually begins in childhood. The second leading cause of death in the United States is cancer. It's estimated that over 1,500 people die each day in the United States from cancer. And again, diet is intimately related to our risk of developing certain cancers. Several years ago, the World Cancer Research Fund published its cancer prevention recommendations. And some of the things are pretty obvious, like, trying to maintain a healthy weight, remaining physically active, not smoking, not drinking. But when it came to diet specifically, what the report showed was that a healthy diet and lifestyle behaviors could prevent estimated 40% of cancers, and that basing our diets around plant foods like vegetables, fruits, whole grains, which contain a lot of fiber and protective phytonutrients, could reduce our overall risk of developing certain cancers. Many of you may have seen this report that was put out by the International Agency for Research on Cancer, which is the cancer research for the World Health Organization a few years ago. And they wanted to look at the relationship between red and processed meats and our risk of developing cancer. And they assembled, scientists from a variety of fields to create this expert panel. And what the researchers concluded was that processed meats, so things like bacon and salami and deli meats, were a group 1 carcinogen, putting it in the same category as asbestos and tobacco, and that red meat was a group 2A or probable carcinogen, putting it in the same category as DDT or glyphosate. So at a bare minimum, we should be looking to significantly reduce, if not eliminate, our consumption of red and processed meats in our diet. And again, several large prospective studies looking at the relationship between cancer and diet have shown that plant-based diets have been protective. Diabetes is the 7th leading cause of death in the United States. It's a leading cause of blindness among working age adults. It's the most common cause of kidney failure in the United States. We spend an enormous amount. 1 in every 5 healthcare dollars is spent caring for patients with type 2 diabetes. And currently it's estimated that 9.4% of Americans, so roughly 30 million Americans, have type 2 diabetes. And you can see from this graph that there has been, since the mid-1990s, sort of a sharp rise in our rates of type 2 diabetes. And some experts estimate that if the current trends continue, that by the year 2050, 1 in every 3 Americans will have type 2 diabetes, which will just be devastating for our healthcare system. And again, I'm going to end up sounding like a broken record by the end of the talk, but plant-based diets have been shown to be protective in terms of our risk of developing type 2 diabetes. In this large prospective study, again, among the Seventh-day Adventists, they found that those following a plant-based diet had a 60% reduction in their risk of developing type 2 diabetes. And plant-based diets have also been shown to be effective therapeutic tools in terms of treatment of type 2 diabetes. There was a study that was published several years ago comparing a plant-based diet to the standard American Diabetes Association diet. And those following a plant-based diet had a greater improvement in glycemic control with a lower hemoglobin A1C. They had a greater reduction in their LDL cholesterol. They lost twice as much weight. And the finding that I found to be the most compelling was that they had a 43% versus 26% reduction in their overall medication use. So once a patient has a diagnosis of type 2 diabetes, it's possible to put them in remission or to significantly decrease the amount of medication that they need to control their type 2 diabetes. And again, just as with heart disease, not to sort of give away my age, but when I was in training, when I was a medical student, when I was a resident, we used to call it adult onset diabetes. And the nomenclature had to change because we're seeing it increasingly in our pediatric patient population. The rise in rates of type 2 diabetes have paralleled our increasing rates of obesity, both in the adult and pediatric population. And again, in this study, you can see sort of a stepwise decline in the average BMI in those found, the more the diet trended towards plant-based, with the vegans having the only average BMI that fell within the normal range. I think increasingly we're seeing that BMI is just one tool, and I don't want to put too much emphasis on BMI and weight, especially in pediatrics. I think I'm just going to skip over this slide. This is just going over the trends in pediatric obesity, but I think it's important to talk about weight and BMI in the proper context. And so as a pediatrician, I always emphasize certain do's and don'ts when it comes to supporting families. I think it's important to focus on family meals, to be a positive role model, to provide children with a variety of healthy choices, to promote a positive body image, and to encourage our children to be physically active. On the don't side, I think no talk of dieting or restriction, no toleration of weight talk or teasing, and to help our children limit the amount of time they're spending on their screens. It's really hard during COVID right now because I think we're all spending way too much time on our screens, but maybe if you can find a way to just go for a walk or have some sort of regular physical activity is really important for children. So just to sum up the health benefits, this quote is from a paper published in 2019, which was a really great paper on plant-based diets. It was actually written by Dr. David Katz, who, if you don't know who he is, I encourage that you follow him. And he was generous enough to write the foreword for our book. But he says that the evidence is strong, consistent, and compelling that a diet of predominantly or even exclusively whole plant foods can promote health, selectively treat and reverse disease, and confer comparable benefit to the planet. What we should be eating then for disease reversal and health promotion for the sake of people and planet alike is clear enough. The truth is that we should all be eating plant-predominant diets. The what of future eating is not in question. The questions are all about how we get there from here. And so I wanted to shift gears and talk just very briefly about some of the environmental impacts of our food choices. I think that...
Oh, I'm sorry to interrupt you. I just saw there was a question in the chat that I just wanted to bring up. We had a question here that was asking, what's the way that semi-vegetarian is operationalized / defined? Is it standard or does it vary by study?
It's not standard. So semi-vegetarian, basically, we sort of outline in our book the difference between all of these terminologies. So semi-vegetarian, flexitarian, pescatarian, we can get into the details of what all those definitions mean. But semi-vegetarian means essentially that you're eating sort of more of a plant-predominant diet, and you may include some animal foods in the diet. So it's a very vague definition. And I think for me, it speaks more to intention, that you're intending to include more plant foods in the diet. And semi-vegetarian is just, there's no measure of like whether the diet contains 5%, 10%, 15% animal foods in the diet. So it is a very vague definition. I hope that answers the question. Yeah, okay. So I wanted to talk briefly about the environmental impacts. I think that as healthcare professionals, we are in a unique position to actually advocate for sustainability, because eating a healthy diet, if you don't have a healthy planet to live on, doesn't make a lot of sense. And so when I think we can agree that there are probably a lot of dietary approaches that can confer health benefits. So if you follow a Mediterranean diet, if you're eating a lot of sort of whole plant foods and not eating a lot of processed foods, I think many, many dietary approaches can provide health advantages. So I think that if that's the case, then we absolutely have to consider the environmental impacts of our food choices. It's estimated that 51% of all greenhouse gases come from animal agriculture, which is, some estimates place it more than transportation. It's the leading cause of rainforest destruction, species extinction, ocean dead zones, and water pollution. It's responsible for 91% of the destruction of the Amazon, and it occupies 45% of the Earth's ice-free landmass. In terms of water consumption, the meat and dairy industry use a third of the Earth's freshwater supply. If you want to look at this from a slightly different perspective, it takes 2 football fields worth of land to feed one person the standard American diet. And these same 2 football fields could feed 14 people eating a plant-based diet. In terms of resources, 50% of the world's grains, when I read this, I was sort of astounded. 50% of the world's grains goes towards feeding livestock. And some experts estimate, this is happening at the same time that close to 1 billion people are going hungry each and every day. And some experts estimate that if we diverted these feeds from feeding animals to humans, that we could largely solve the problem of world hunger. In terms of antibiotic use in the United States, it's estimated that 80% of our antibiotics go towards animal agriculture. And this is harmful not only to the animals that receive the antibiotics, but it's harmful to the humans that consume the animals that get the antibiotics, because it breeds a lot of resistance and a variety of other problems. I think that when you look at the environmental impacts of our food choices, it can be overwhelming. Like when I sort of first started learning about this, I remember being in the grocery store and just like not knowing, okay, this is healthy, but is it sustainable? And it can become really, really overwhelming. And I always like to sort of focus on this idea that simple changes enacted on a large scale can have an enormous impact. So something as simple as cutting back our meat and dairy consumption by 15%, which would be the equivalent of meatless Monday. If all we did was meatless Monday, it would be like taking 240 million cars off the road each and every year. So we know that food is intimately connected to health, but we're seeing increasingly that food is intimately connected to the health of our environment. And we're seeing this in dietary guidelines and recommendations. I don't know if any of you saw the Canada Food Guidelines that were put out last year. And I wish, I don't know if you guys saw the new USDA guidelines, the 2020-25 guidelines that came out for Americans. And I wish that actually we were Canadian, because I think the Canadian guidelines are much better. And the reason that there's a difference between the Canadian food guidelines and the US food guidelines is because of the effect of industry. I think industry has an enormous impact on our dietary guidelines, whereas in Canada, industry was absent from their recommendations. So if you look at their plate, you can see that it's mostly plant foods. There's some animal foods. And the most remarkable thing is that they took dairy completely off the plate. And so they offer water as the beverage of choice. So for those of you who haven't seen the Canada Food Guidelines, I recommend them. I think it's just a really wonderful approach. And they talk specifically about the role of climate in terms of our dietary recommendations. There was a report published last year called the Eat Lancet Commission on Food, and this was an assembly of a variety of scientists and experts from a variety of fields, from health and public health to climate change, you name it. They had the sort of experts involved in this panel. And they wanted to answer the question of, can we feed a future population of 10 billion people a healthy diet within planetary boundaries? And what this panel of experts concluded is that food is the single strongest lever to optimize human health and environmental sustainability on Earth, and that a diet rich in plant-based foods and with fewer animal source foods confers both improved health and environmental benefits. There was an article published in the New York Times a couple of years ago in which they looked at the impact of a variety of diets on environment. And it's not surprising to know that a vegan diet was the most climate-friendly diet. And I also think that every year I've been speaking at Stanford for the last few years, and every year something would come up in the headlines and I would want to talk about it in the talk because, in 2018, we had the California wildfires, which we've had again this past year. In 2019, we had the burning of the Amazon. And it's hard to believe that it was just in early 2020 that we had the bushfires in Australia. And all of this is related to climate change. And over this past year with COVID. And I think you can sort of connect the dots with all of these scenarios. There was another article that was published in the New York Times I think it was summer of 2020 by Jonathan Safran Foer. It was an article called "The End of Meat is Here." And he says that if you care about the working poor, about racial justice, and about climate change, you have to stop eating animals. In the article, he says, our hand has been reaching for the door for the last few years. COVID-19 has kicked open the door. On the other side is not something new, but something that calls from the past, a world in which farmers were not myths, tortured bodies were not food, and the planet was not the bill at the end of the meal. One meal in front of the other, it's time to cross the threshold. On the other side is home. And for those of you who are interested in learning more about this particular topic, he also wrote a full-length book called We Are the Weather, Saving the Planet Begins at Breakfast. And I love this quote. It's one of my most favorite quotes from the book. And he says, changing how we eat will not be enough on its own to save the planet, but we cannot save the planet without changing how we eat. So that's just some food for thought. And then the last little thing I want to mention, and this is perhaps like the most delicate and tender topic. And for me personally, it was the last place that I was able to sort of explore. And that's for the sake of the animals. My co-author, Brenda Davis, has this beautiful quote that I like to share when I talk about this topic. And she says that being vegan isn't about personal purity or about moral superiority. It's about making a conscious choice to widen your circle of compassion by avoiding animal exploitation as far as is possible and practical. And Americans agree. There was a poll conducted by the ASPCA a few years ago in which they found that 94% of Americans agreed that animals raised for food shouldn't suffer. But the reality is that 10 billion farm animals are raised and slaughtered for food in the US each year. And 99% of these animals come from factory farms. So it's just something to consider. And this extends into our oceans. I was really surprised to know this, that for every 1 pound of fish that's caught, 5 pounds of unintended marine animals, such as turtles and dolphins and other marine animals, are caught and discarded as bykill. So that sort of sums up the benefits. And I hope that I've shown you that it's a healthy, sustainable, and humane way of eating. We can take questions, or I can continue with my talk. Alex, how would you like to move forward?
Does anybody have any, I have a quick question that I actually wanted to ask. If anybody else has questions, they can definitely ask as well after. I particularly was wondering, so I have a little bit of experience. Actually, I was just a little background. I actually was a pre-vet major in animal science for a long time. So I had the opportunity to, in undergraduate, actually raise animals and raise pigs and see kind of sometimes the effects of that. So just in your talk, it was so interesting that you mentioned that. I was wondering what your opinion is, particularly on some of these, now that a lot of let's say, I think like the Impossible Burger and Beyond Burger and some of these quote unquote like meat substitutes are coming out. Where does that fit in terms of, say, bridging the gap? Do you feel like it's helping people maybe transition to the vegetarian diet or whole food plant-based, or how do you feel that that's fitting into?
Yeah, it's a great question. I get this question quite a bit. So, I would say that I think that these foods definitely have a place in our dietary approaches. I think that, I would not necessarily consider, comparing the Impossible Burger to black beans and rice with a kale salad. There's no question in terms of the nutritional impact. But in terms of the environmental advantages, in terms of the ethical concerns around factory farming, they definitely have an impact. And I would have sort of ended the conversation right there. But there was a study published, I think it was just a few months ago, looking at comparing the health effects of the Impossible Burger versus like a standard beef hamburger. And I was surprised to see that there are actually some health advantages. Now, it's definitely one of the things that Dr. David Katz says that I always love is when you're talking about comparing different foods, it's always important to ask in comparison to what. So if you're going to compare an Impossible Burger to a beef burger, I would say there are many, many advantages, because maybe some potential health advantages, though probably minimal, but in terms of the environment and the ethical issues. Now, if you're going to compare an Impossible Burger to black beans and rice, that's a different story. So I think that these foods can help transition people. I think they can also we definitely eat food for nourishment and for nutrition and for disease prevention, but it's also about joy, and it's a cultural experience. It's a family experience. And so if having these foods available allows you to feel like you're more likely to maintain a plant-based diet, I'm 100% for it, because I think the number one reason that people sort of start eating plant-based and stop is they find it to be too challenging. They can't go out to, at a time when we're eating out in restaurants, they can't go out to restaurants and enjoy things and be a part of those things. So I can tell you personally how I don't know if it's useful to you to how I incorporate those things in my diet. I think the more that you start eating whole plant foods, your palate sort of begins to change and you end up enjoying those foods a lot more. If we're going out to dinner and I see that there's an Impossible Burger on the menu, it's a relief because I know that there's something that I can eat. So for me, those foods are sort of outside foods, like if we go out to dinner or if there's like a special celebration. And sometimes we have those things in the house as well. But, again, focusing on that circle, what we do most of the time is so much more important. And if having an Impossible Burger or those things is going to make it easier for you to sort of maintain this in the long run, I'm 100% for it.
Thank you.
Yeah. So one of the questions that often comes up is, it's wonderful that you can prevent chronic diseases and it's great that it's helpful for the environment. Oh, did you have a question, Laura?
Yeah, we had a question.
Oh, I'm sorry.
Yep, I didn't see. Yeah.
Oh, sorry. Yeah, I wanted to ask, I'm loving your presentation so far. It's amazing. And so insightful of how like plant-based diet can really improve someone's patient's life with chronic disease. And earlier you mentioned that in medical school, when you were in medical school, they didn't really teach nutrition, and since then, really nothing has changed. We were taught the citric acid cycle as well, and nothing much about nutrition. I'm just curious from your perspective, like what would it take for medical schools or health related schools to kind of embrace nutrition a little bit more and have more nutrition classes or initiatives?
I will, on the one hand, it makes me sad that you're still, the focus is on those like biochemical pathways and things, which is important. I don't mean to downplay, like we need to learn all that stuff, but I think actually like what you're doing now is exactly what needs to be done. I didn't see any lifestyle medicine like groups like you're creating now. And I think the more that medical schools have groups like you that are engaging in conversation and interested in learning about more, the vast majority, all of my nutrition education came 15 years after I was already in attending, because I started going to conferences. And I think it's surrounding yourself with like-minded programs, looking for residency training programs that incorporate these things. And because that's also growing, I think. So it's really sad and disheartening to know that it's so slow moving. But I think the greatest hope I have is that there's such enthusiasm from the residents and the students. A few years ago at Stanford, I've sort of taken a pause with clinical care with COVID and everything. But a few years ago, Stanford actually ran a pilot program in their medical school where they did a teaching kitchen. So unfortunately, they ran out of funding, but essentially what they did is they had a faculty coordinator, and then they had a volunteer faculty, which I was a part of. And it was limited to only 15 students, but basically the medical students signed up for the elective. And every week they met, and there was a short, brief curriculum about some aspects of nutrition, whether it's how to cook beans or how to cook grains or how to incorporate these. And then for an hour and 15 minutes, the students cooked and the faculty sort of talked to them. And at the end of the cooking, we all sat down and shared a meal. And so I think that at the student level, you can advocate for that. I'm sure within your medical school system, there are mentors and advocates you can find. Engage them, and just like you did with me, reach out, because I think the people that are really interested in this are so excited to talk about it. So I think it's finding the resources within your school and doing exactly what you're doing. Like creating a group like this is fantastic. And it's so inspiring and encouraging to me.
Yeah, actually, I think we're really lucky to be at Downstate because there are some faculty that are advocating for plant-based diets, and actually the LMIG and DINE, another student-led group, we were able to secure some funding to create an in-house garden at the hospital. So hopefully, with the produce that's made in the garden, we can maybe create more teaching kitchens like at Stanford, where students can join in and participate in cooking and share a meal with each other.
Yeah.
That way promote more nutrition.
Oh, absolutely. And I think the other thing is like, there are two aspects of it. One is more institutional and sort of creating change within your academic institutions. And then the other is just your own personal growth and development. And so I think that if you're able to, I think one of the things about COVID, it's made a lot of conferences and things more accessible because it's all like virtual now. But for me, finding a sense of community was really important. So find, whether it's the American College of Lifestyle Medicine or different conferences that focus on that for your own, and it just sort of opens up your world because it exposes you to people that are doing the work. But I think you guys I'm so impressed that you have this group.
Thank you. It's encouraging.
Yeah. And also I think that you can support one another. So whether it's, getting together once a month when we're able to get together and having a potluck and doing a journal club or other things to sort of increase your own learning and create a sense. I think it's really important to create a sense of community around it because that's what makes it fun and engaging.
Definitely 100%.
Should we continue with questions or do you want me to go through the talk?
Yes, that would be, someone actually just put in the chat that they have a question they're typing out.
Okay, I'll wait.
Sure. Okay.
Still relatively early in California, so I'm still working on my coffee, no problem.
Okay. Okay, so it's here in the chat. Read it. He says, I may be the sole public health student here, but I'm writing my dissertation on food insecurity. So for me, I want to try to take this work on the importance of whole food plant-based diets and make it work for the communities we serve culturally and economically. But if we know that there are food deserts and that food insecurity was already an issue pre-COVID that is now exacerbated, in what way can we work with progress, not perfection, toward whole food plant-based for people that may be food insecure?
Yeah, and I think it's a great question. I think that for the vast majority of my professional life, I've worked in low-income, underserved communities, and I think, talking to them about goji berries and chia seeds and flax seeds, it's not accessible. And there was a moment, actually, I'll share a little clinical story that changed my perspective on this entirely. I was precepting one of the residents during their continuity clinic, and the resident was trying to talk to the family about diet, nutrition, and healthy eating. And I could tell when the resident started presenting that he was really frustrated. He's like, well, the mom is just not listening. She's on her phone and she's just not interested in my message. And so we went in together, and I could see that the mother was very disengaged and even maybe a little bit sort of cold. And I just sort of paused and I said, you seem upset. Is there something, can you tell me what's going on for you? And she looked up at me and she said, he's talking to me about eating more fruits and vegetables. Do you know that I have to take 3 buses to get to the grocery store? Once I take those 3 buses, I have to find a way to get back to my house with all of those groceries if I can afford them. So no, I'm not interested in what you have to say. So it's a very real concern. And I think the first step is to listen and ask a lot of questions before you start telling people what to do, and maybe perhaps not even tell people what to do, period. So I think you have to sort of understand what their goals are and see how you can support them. And I think it's a real problem with the plant-based community in terms of making it more accessible. One of the things that I'm always impressed by is when you look at a lot of these blue zones, what I talked about earlier, the foods that they were eating were not fancy. They were like, greens and beans and rice and things like that can be very economical. But I think addressing food insecurity and I think in the United States, I'm kind of all over the place because it's something that I thought a lot about, but I think in the United States, the other thing is we don't recognize how much industry and lobbying efforts impact our food choices and what's available. So for instance, even if you look at one small thing like the dairy industry and their connection to the USDA guidelines, the dairy is like they're recommending that we drink 2 to 3 glasses of milk a day for bone health and a variety of other things. When you consider that roughly 70% of the global population is lactose intolerant, like how culturally sensitive are those recommendations? But there is a huge connection and a huge lobbying effort from the dairy industry into our guidelines. And in some ways, I think that the real problem is sort of disconnecting those two things. So if we're not and those recommendations, even though we may not follow them personally, they have an enormous impact in terms of the food that are supplied through supplemental nutrition. So WIC, school lunch programs, they're all influenced by that. And so I think that we have to sort of prioritize whole foods like we do a lot of the lobbying efforts. It's a very complicated question. And I'm so glad that there are people like you that are interested in learning more about it. I don't really have any easy answers, but I think as a clinician and as someone who works with residents and students, I think what I can do at my level is to find out what is accessible to them, find out what foods are culturally appealing to them, and working with them. So one of the things I do when I do a diet history is I say, tell me about the foods that you eat, like walk me through a day of eating. What does it look like for you? The hospital system that I was working at, we have a large, I would say 80% of our population is Spanish speaking. And so a lot of times parents will say, well, I will cook soup and tortillas and beans, but they don't want that food. And so I'll get them McDonald's. So trying to find, existing resources and support that they have and sort of brainstorming what they can do with the resources that they have.
Great. Thank you. Yeah, that was all our questions.
Okay.
In the chat.
And I want to say how we have I think we have like a few more minutes. Maybe I'll just kind of whip through some of these slides and then we'll just open it up to conversation. So one of the main questions I get is, is it a safe way to feed, especially growing children? Is my family going to meet their nutritional needs? And what about the protein? If I never have to answer this question again, I would be more than happy. But protein is a question that comes up over and over again, so I did want to address that specifically. There was a position statement that was put out by the Academy of Nutrition and Dietetics. And for those of you who don't know, the Academy of Nutrition and Dietetics is the world's leading dietetic organization. They're not vegan, they're not plant-based, they're just like the American Medical Association, the American Academy of Pediatrics. They are the academic organization for dietetics. And they put out a position statement in 2016, and I'm just going to read it because this is what I reference all the time. They say, it is the position of the Academy of Nutrition and Dietetics that appropriately planned vegetarian diets, including total vegetarian and vegan diets, are healthful, nutritionally adequate, and may provide health benefits in the prevention and treatment of certain diseases. Well-planned vegetarian diets are appropriate for individuals during all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, and for athletes. I think where most people, including pediatricians, get stuck is the words appropriately planned and well-planned, because what does it mean? And do I even have time enough to do that? And so if we're serving our kids a school lunch that looks like this, we don't think twice about whether it's going to meet their nutritional needs. But if we wanted to swap it out for something that looks like this, we become really concerned. So what I would say is that all diets for children need to be appropriately planned, whether you're plant-based or omnivorous or semi-vegetarian or flexitarian, all diets for children need to be well planned. And this is just, I'm going to skip over these slides, but this is just looking at what our diets actually look like in terms of, do Americans eat a healthy diet? Only 12% of adults meet the daily fruit intake recommendations and 9% meet their daily vegetable intake recommendations. This is a reflection of what the average American diet looks like. And you can see that 63% of our calories come from processed foods, 25% from animal foods, and only 12% from plant foods. And of that 12%, you can see there's a dark green and a light green. The dark green represents true plant foods like blueberries or, an avocado. And the other 12% is foods that contain plant foods. So the peanuts in a Snickers bar count towards the plant food. So we are not eating a well-planned diet as it stands. And there have been lots of studies looking at the growth and development of children eating vegetarian, vegan diets. And as long as kids are provided with enough variety and quantity of food, they grow just as well as omnivorous children. And again, just more studies looking at, for those of you who are specifically interested in this topic, there was a study published just in 2019 called the Vegan and Vegetarian Children Study out of Germany, which looks at this topic in detail. And I think over the last several years, there has been an abundance of resources and Impossible Burgers and fortified foods that certainly makes it easier to follow this way of eating. And again, I emphasize eating enough quality, quantity, and variety of foods. We're not going to have time to talk about all these specific nutrients, and that's why we wrote this book so that it covers all these topics. This is on our website, which covers some of the common nutrients of concern when people are eating a plant-based diet. So I just wanted to sort of point that out for reference. I had two things that I wanted to talk about specifically. For those of you who might be interested in doing more plant-based eating or might already be plant-based entirely, this is the one supplement that you absolutely have to pay attention to, which is B12. And I think when you see disastrous outcomes in people who are following vegan diets, oftentimes it's related to not adequately supplementing with B12. The good news about B12 is it is cheap. There are really no side effects. And it's so easy, whether you're taking it through fortified foods or through an individual supplement. So B12, the experts agree. And I like to emphasize that it's not just vegan or plant-based eaters that need to be worried about B12. Certain medical conditions like celiac disease or absorption, GI absorption, malabsorption issues, you need to fortify with B12. And the Institute of Medicine actually recommends that everyone over the age of 50 takes the B12 supplement because it's harder to meet your B12 needs. And then maybe the only nutrient I'll sort of talk about is protein in greater detail. I think that protein, we're so hyper-focused and obsessed with protein. It's just not a nutrient that I'm worried about. If you're eating a variety of foods and you're eating enough calories, it's really difficult not to meet your protein requirements. All of these world-class athletes eat vegan diets. And, if they can be doing what they're doing on a plant-based diet, for me and my 30 minutes of Peloton, I'm not worried about being able to meet my protein requirements. In terms of specific protein requirements, it changes by, it's based on your weight. So you can see the recommendations in terms of protein requirements change throughout the life cycle. Some experts recommend that if you're eating a really high fiber diet, that you need to increase the amount of protein in your diet so that you account for digestibility of protein. I just wanted to sort of show this comparison. People just assume that you cannot meet your protein requirements eating a plant-based diet. And this is just some comparison. So you look at a portion of lean beef, chicken, or fish, and you can see that it gives pretty comparable amounts of protein as tofu, beans, and edamame. Things like cheese and eggs give you similar, you can get similar amounts of protein in a variety of lentils and nuts and seeds. And even milk, you know, think about cow's milk gives 8 grams of protein per cup. You can get similar amounts of protein from a plant-based or soy milk. I think I'm going to skip over this. This is actually a really nice graphic I wanted to share. When you look at 22 grams of protein that you can get from beef versus from beans, you get some pretty harmful things when you get the protein from beef, including saturated fat, cholesterol. It costs more money and it has a greater usage of water compared to beans, which have 22 grams of fiber. Same amount of beef has no fiber whatsoever, as well as other micronutrients and phytonutrients. 97% of Americans meet their daily protein requirement. Less than 3% of Americans meet their daily fiber requirements. So I'm much more interested in talking about fiber than I am about protein. There are other nutrients that you may need to pay specific attention to eating a plant-based diet, but I remind people that these are nutrients of concerns even in people who don't follow a plant-based diet. I've treated kids for iron deficiency anemia. I've treated kids for vitamin D deficiency rickets. None of them were eating a plant-based diet. So yes, there are some nutrients you may need to pay attention to, but these are nutrients all of us need to pay attention to. And okay, maybe I'll just end with this little story. I call it the zucchini story. So several years ago, I had a really dear friend who is a psychiatrist. So she's medically trained and she's had some health problems in her life. And she wanted to really transition to a plant-based diet. And so one day she said to me, Reshma, you're going to be so proud of me. I took 2 zucchini to work. I microwaved them and I had them for lunch. Isn't that great? And I thought, that sounds disgusting. Like who would want to eat 2 microwave zucchinis, you know, and eat that for lunch? I think there's a better way. You have to make the food appetizing. It's definitely a health promoting way to eat, but it's also like a delicious and vibrant way to eat. There's so many different like ethnic cuisines that are very plant forward, from Ethiopian to Thai to Indian. So it has to be delicious. I don't want anyone sort of stuffing kale in their mouth and doing it begrudgingly. It should absolutely be delicious. I'll share this short little video clip because I think it's kind of funny and it'll just help us.
Tired of running to the store for expensive meal replacement bars? They cost a fortune. At the Physicians Committee, we have the perfect solution: the meal replacement bar, replacement meal. It has all the nutrition of a meal replacement bar, and you can make it right at home. Start with a green salad, add pasta with tomato sauce, some sauteed spinach, and a chocolate brownie for dessert, and you've got it: the meal replacement bar, replacement meal. Voila. And if you're looking for a cleanse, we've got you covered there too. For more information, visit meal replacement bar replacement meal.org.
Okay, so just a few take-home points. I think it's important to focus on real whole foods. Make it delicious, make it appealing, experiment. Don't be afraid to try new things. Cooking is key. I think that with the pandemic, I think more of us are cooking at home. I'd love to know more about your cooking adventures and how you're sort of feeding yourselves. I think food over supplements whenever possible, but that doesn't mean that we shouldn't pay attention to specific nutrients. I think one of the biggest criticisms I hear against plant-based or vegan diets is that how can it be an adequate diet if it requires supplementation or fortification? And people forget that our food supply is heavily fortified. When you consider cow's milk is fortified with vitamins A and D, that grains and cereals are fortified with folic acid, infant cereal is fortified with iron. It doesn't, eating an optimal diet that requires some degree of fortification and supplementation doesn't make it an inadequate diet when you consider that all of our diets are fortified to some extent. And I think it's also important to emphasize eating together and with joy and making it an experience. All right, that's all I have. I'm going to stop my screen share. Let's see. Okay. All right. Okay. I talk really fast. I'm sorry if I whipped through the last section of the slides, but I would be happy to take your questions if you have any.
I actually have a question. Thank you so much for this talk. And I wanted to ask, so I've been vegan and vegetarian for so long, like since high school. And I've heard, and I was also a nutrition major in college. And I've heard so many conflicting things about, and I'm sure you get this question all the time, about soy.
Yeah.
And soy is like, tempeh especially is such a main staple of my diet. Like I feel like I'll have like a tofu scramble for breakfast and then tempeh for lunch. How do you feel about soy? Like, should there be
I think that soy is one of the most health promoting and delicious things that you can incorporate in your diet. So if you look at a lot of the studies that look at health outcomes, so I think the main concerns around soy, I would say, are breast health, feminization in men, so gynecomastia, things like that. And then also, so I think basically like hormonal effects people are concerned about soy. And then the last thing is for people who have hypothyroidism or its influence on thyroid health. So for all of those things, when you look at Asian populations, they have better outcomes with breast health and things like that because they consume soy in the diet on a regular basis. There was one case report that looked at feminizing effects in men of increased soy consumption. And it was based on 2 case reports. And both men were consuming incredible amounts of soy. And they were consuming like soy isolate products. So like the very, very processed soy, like 15, 20 servings a day. So just as with anything, even with kale, don't eat 15, 20 servings a day, but 2 to 3 portions of soy in the diet on a regular basis is absolutely health promoting. It's got fiber, it's got protein, it's got fat, it's got, especially if you're using tofu that's calcium set, it's a great source of calcium. And it adds a lot of versatility in the diet. I mean, pretty much tofu takes on the flavor of anything that you're cooking. And it's great, especially when, when people are transitioning, if you're going to do a chicken stir fry, you can do a tofu stir fry. I think that's what we might have for dinner tonight. So I have no concerns about soy. If you look, PCRM, and Alex, I can share these links with you later if you want, but PCRM has a wonderful, do you guys know about PCRM? So PCRM is the Physicians Committee for Responsible Medicine, and they are a research and advocacy organization, and they have wonderful handouts, and they have one on dairy, they have one on soy, and it's a great reference point for you, and if you want to share with other people as well. So I definitely recommend it. So I'm not concerned about soy. Now, if you are someone who has hypothyroidism and you find that certain goiterogenic, yeah. So what I would say is if your TSH level, if your levels are fine with that amount of soy in the diet, you don't have to worry about it. I think the one concern that people have is that if people are sort of borderline hypothyroid, they're not quite there. There has been some speculation or concern that eating a lot of soy foods or goiterogenic foods could kind of push you over that threshold. But I think it's a very small segment of the population. And even in Asian countries, in women who have had breast cancer, soy foods have been shown to be protective. So I don't think, unless you have a soy allergy or unless there's like a specific thing that you're managing in terms of your TSH and things like that. And I think I'm not an endocrinologist, so work with your endocrinologist, but you can sort of, adjust your dosing to accommodate those foods in your diet.
Yeah. Thank you for that. I do have hypothyroidism, but I don't necessarily it runs in my family. It would have happened anyway.
And to clarify, I don't think that soy is the cause of the hypothyroidism. I think it can influence your medication dosage, if that makes sense.
Right. Yeah. And I did talk to my endocrinologist about it, and he said that it's fine. I just should eat it like an hour after my medication. So like he wasn't concerned by it either.
Yeah. And I think that soy has so many health advantages. I would absolutely, unless you have an allergy or a specific reason not to include in the diet, I think it's great to include in the diet.
Okay. Thank you for that explanation.
Hi, Dr. Shah. Thank you so much for your presentation. It was really informative. So I grew up in China, and growing up, there's a lot of, just staple food that contains meat that I just love. And I've learned more about plant-based diet in the past year, and I'm very convinced about its health promoting benefits. But I'm going to sound like a little bit of a devil's advocate and ask you, in your opinion, is there any benefit to consumption of meat, if anything?
Yeah. And I love people who are devil's advocates because it makes me learn and grow as well too. So I think a couple caveats. So I'm forgetting who asked about the food insecurity question, but in countries where there is limited access to food, so there was a study published last year by the Harvard group called Milk and Health, and whether milk is necessary in the diet. And one of the things that they stated in that paper was, if your only access, if it's milk or other low quality foods, I think absolutely milk and meat. If you are in a situation where that's the only access to calories and nutrients, absolutely to include it. So I would never advocate, in impoverished areas where there's no access to food, to eliminate those foods if those are the only ready sources of protein and calories and fat and things like that. I think for people where it's more of a, if you have access to food and if you have food security, I don't think there's any advantage to including meat in the diet. If it's something for more of like personal preference and taste, one of the things that you can do is, if you're not ready to go vegan or to go 100% plant-based, it's okay. But try considering, so give me an example of a dish that you just love that includes meat.
So for example, I mean, the one on the top of my head would be like, double cooked pork belly. That would definitely require, pork.
Right.
That cannot be substituted for tofu.
Right. So what you could do is consider having like a small serving of that with like a load of vegetables and rice and whatever you do. And so using that food as a flavoring more than anything else. But for those of you who I'm sure all of you are on social media, I'm not quite as savvy, but like there's so many bloggers and people who are doing the most amazing things. There's a woman, I know it's not Chinese food, but there's a woman who's an attorney, and she is the Korean vegan, and her food is just like, it looks so mouthwatering, and it's all vegan, it's all plant-based. And I think just baby steps. So maybe when you do your meal with the pork belly, it has like very few pieces of that and lots of vegetables and rice and things like that. So it's about crowding it out and using those things as a flavoring. So I think if you have food security and you have access to food, there's no particular health advantage of including animal foods in the diet, in my opinion.
Got it. Thank you. I'm definitely going to try more the plant-based diet. And I mean, right now I'm thinking about making basil fried rice, and instead of using shrimp or chicken, I'm going to go with tofu.
Yeah. And I think over the last 5 years, there's been sort of an explosion of plant-based products. Some of the top ones, and again, it's a combination of balancing the health aspects, but also making it so it's sustainable and enjoyable, and you feel really excited to eat the food. There's a product called Just Egg, which is basically, it looks like scrambled eggs and it's made out of mung beans. So when my husband makes fried rice, he uses Just Egg in it, and it's delicious. So you just have to be a little creative. And if you're not ready to, there are different approaches. So some people say, they'll try vegan before 6. So breakfast and lunch will be plant-based. And then if you want a little flexibility at dinner, that's perfectly fine. And just to tell, I did not go 100% plant-based or vegan overnight. It was a very slow growing process. So if it's helpful to share with you, I grew up in a vegetarian household. So for culturally, for me to eat like lentils and beans and vegetables was very much a part of what I grew up with. So it wasn't such a hard thing. So in our household, what I did was, instead of making vegetarian vegan meals 2 days a week, I did 3 and then 4 and then 5. Or we just did plant-based at home. And then if we were going out to dinner, had a little more flexibility. You could just, the flesh foods for me were fairly easy. The chicken, the fish, the pork, all that stuff. The things that were harder were dairy and egg. So those were the last things that sort of went out of my diet. Don't worry about being perfect. I think and if it's really overwhelming, just think about where you can add things in. So make the same dinner you would do. And could you add more vegetables? Could you add more whole grains? What can you add instead of focusing on what you might have to take away?
Thank you. That's very helpful.
Yeah. But it does sound like you like to cook and like you enjoy being in the kitchen and making meals that are really satisfying. So that's a great first step,
Oh yeah, very much.
Do we have any more questions, Alex, or?
Do you have any other questions? This has been fantastic. Just want to say this has been so informative. Wonderful presentation. Thank you so much.
It's my pleasure.
I just have one more question. What's your favorite Indian dish to make or to eat? I love Indian food. It's like my favorite cuisine.
That's like a really unfair question because I can't pick one. But I will tell you what we made for dinner this week that was Indian. I made chana masala.
That's my favorite. I just had that the other night.
Yeah. And I make it, I have a recipe that you can make either with canned chickpeas or you can make it in the Instant Pot. I don't know if you guys have an Instant, like, you know, it's like a pressure cooker. So that's probably my favorite thing. And I, you know, my mom, she cooks very traditional meals and I've definitely sort of like Americanized them to make them a little easier. So we had chana masala with steamed rice, and then I make like a sheet pan aloo gobi. So instead of like doing the whole thing and all that, I just basically chop up some cauliflower, some potatoes, some sliced onions, some red peppers, because my kids love that. And I toss it with a little olive oil, salt and pepper. And my mom would be horrified, but curry powder. And I just mix it all together. I throw it in the oven while I'm making my chana masala. And then I top it with a little fresh cilantro. And I always cook more than we need because the leftovers are like the best part. So chana masala, I think, would be my go-to thing.
Amazing. So good. I always get that and bindi masala at every single time I order Indian food. And then I have leftovers for like the next 2 days, and it's amazing.
I think you guys are all foodies. You all like love food. So that's exciting.
I recently just wanted to chime in and say I recently got an Instant Pot and it has changed my cooking so much. I love using it. So convenient. And I started cooking Indian food, which I was always scared to do because I was nervous in terms of, I didn't know how to, all this, you know, the spices and the complexity of it, but I felt like it just made it so user-friendly for me. And I love cooking with it now.
Yeah. My favorite thing to do in the Instant Pot lately has been, I use it to cook chickpeas to make homemade hummus. And once you make homemade hummus, you're not going to want to buy store-bought. It's just so delicious. My kids eat it by the spoonful.
That sounds great. That's my next up. Okay. Okay. So many questions. This has been fantastic. I just want to.
And I would say find the faculty mentors. Find the faculty mentors at your institution. If you have questions or want resources, feel free. Alex, feel free to share my email if anyone has questions afterwards. And just keep doing what you're doing. Like, I think your enthusiasm and your excitement around this topic is what's going to change nutrition education in medical school. I certainly wasn't doing what you were doing when I was a medical student. So kudos to you guys.
Thank you so much. It's been
great. Have a great rest of the day.
You too. Thank you so much.
Thank you
so much.